I would like to start the conversation with something that happened to me about 2 weeks ago. And that is that the patient was on Eliquis, desperately needed some teeth extracted, and the doctor said that I had to extract the teeth on the Eliquis. And I had to do it. I had no choice. I had to do it. I knew the family, luckily, and they trusted me, and I was able to do it. And I was able to get the patient to clot. Most of the time that does happen. It's very rare that they don't. There's lots of reasons for that. But I was able to put in a foam, which made them clot. But let's go around the table and talk about patients are terrified to let you come into the home and do an extraction because of the blood thinners. Joy, how do you handle that?
In Illinois, I'm required to have a written medical clearance from the physician stating that the patient's medically competent to have the tooth extracted, as well as I also make sure that the right hand knows what the left hand is doing. Incredibly important. The medical doctor needs to know what I'm doing, and I need to know what they're doing and what they consider more important, whether or not the patient needs to be on a blood thinner like Eliquis or not. Once we have that established, if they decide that the patient is going to be on it, then we try to make or schedule the appointment as far in between the dosages as possible. So if they're doing it morning and afternoon or morning and night, then it's in the middle of the day that I am providing that treatment for them. And then, of course, like you were saying before, I do not leave until the patient has stopped bleeding. That is critically important. To make sure that the patient is going to be in a good place for healing. And I also agree with you. There is a special foam that we can use that will also do a wonderful job in help maintaining the area, as well as to help promote good healing around the gum.